Hello everybody. Today we're going to be going over aplastic anemia. Well, aplastic anemia is a form of normocytic and normochromic anemia. Normocytic, which means normal cells, and normochromic, which means they actually have normal color red blood cells. So let's go over this. What are the general characteristics of aplastic anemia? Well, this is actually bone marrow failure. Huh? Yeah. The bone marrow has failed to do its job. What does bone marrow do? Let's think about it. It makes red blood cells, it makes platelets, and it makes white blood cells. Those three cell lines, that it's its job. Do we need those three? Of course we do. But if the bone marrow decides to fail, right, and said, I quit, I am not going to do my job anymore, we develop aplastic anemia. That's basically what aplastic anemia means. The bone marrow basically resigned. It's very, very unfortunate. Well, if it resigned, we have a terminology for something that affects all the three cell lines that the bone marrow refuses to make, right? So let me just draw an analogy, right? So it does three things. It gives us our nice, cute looking red blood cells, right? Donut shaped, RBCs, right? We get big guys, right? Right? We get the white blood cells. We get all excited. And we get the cute little platelets. They're nice and blue. The problem is, once this does not happen anymore, right? We cut all three cell lines. The terminology we give that in medicine is called pancytopenia. Pan means everything has been affected. Every cell line has been affected. The workers are out. The entire union is not working anymore. That's pancytopenia, means no shortage or decreased amount. Well, typically if it's just one cell line, if it's red blood cells, right, we call that anemia. If it's platelets, we call it thrombocytopenia. And if it's white blood cells, we call it neutropenia. But because these patients have all three cell lines, they're going to be, to break that into three, they're going to have anemia, right? That's what happens when you affect the red blood cell line. And if it's platelets, thrombo, from the word thrombose, which means to clot. That is the job of platelets. If you don't know, I have saved your life. I made a video on the coagulation or the clotting cascade. Go and watch it. It's in the hematology lecture. So thrombocyto, the cells, penia, they're very, very low. And when the neutrophils is very, very low, we call that neutropenia. See, it is very, very easy because neutropenia, thrombocytopenia, anemia, right? All three cell lines we call pancytopenia. So let's go into what actually causes aplastic anemia, right? What causes these patients to become pancytopenic? And I'm just going to break it down into different categories. Guess what? The most common cause of aplastic anemia is, I don't know. What? Yeah, we don't know. That is the bad news. Idiopathic. We're idiots because we don't know what actually causes pancytopenia in patients that have aplastic anemia. And you know, the way I remember it, the bone marrow has become a plastic. A plastic does not make anything. Okay? So that's majority of cases. But there are other things that's associated that can cause aplastic anemia, like radiation. Ooh, no, you don't want to be radiated, right? So if you have cancer and you're getting a lot of radiation to the bone marrow, the radiation, it's like shooting and killing the cell lines. They can die and you can develop aplastic anemia. What about medications? Meds. What meds usually fall under this? Gold. Also, if you get exposed to benzene, or actually, I take that back, not benzene, chloramphenicol, which we don't use anymore. Chloramphenicol, that's an antibiotic. Also, sulfur drugs, sulfonamides. Sulfur medications can predispose you to develop aplastic anemia. But also, we have infections such as viruses. What viruses are notoriously known to cause aplastic anemia? The most common is parvovirus. Also, hepatitis B, hepatitis C, and Epstein-Barr virus. Hep B and C, the Epstein-Barr virus that causes infectious mononucleosis, right? Epstein-Barr virus, EBV. Also, CMV, cytomegalovirus, and herpes zoster virus, varicella, HIV. Almost sounds like we're listing every single virus under the sun. Any virus can almost cause aplastic anemia. Remember, we really actually don't know what actually causes it. Also, chemicals, right? Let's put chemicals here. That's where I was trying to bring benzene. So if you ever work as a chemist, right? We work with a lot of benzene in the lab, and you've been inhaling it for a long amount of time, you can be predisposed to develop aplastic anemia. Or insecticides. So what usually are the clinical features of this disease? Well, actually, we don't need to cram it. Just think about it. Let's look at the board here. We have anemia, thrombocytopenia, and neutropenia, and that's exactly how we're going to approach it. Those three things are going to give us what the patient is going to be predisposed to and what they're going to develop. So, if they have anemia, what do you think their signs and symptoms is going to be like? Well, for the anemia, what are signs and symptoms of anemia? You feel tired all the time. You have fatigue. You get short of breath. You become dyspneic, right? Because you're not getting enough oxygen to your lungs and to your heart, right? So there's a signs of fatigue, weakness, shortness of breath. What about if you have thrombocytopenia? Let's see. For thrombocytopenia, if I don't have the platelets to actually help me clot every time I bruise my skin against the wall, what do you think I'm going to develop? We're going to develop petechia and easy bruising, right? You develop petechia, which are little dot hemorrhages, right? And that's a sign of low platelet count in your body. And it's very easy for me to bruise, because when these patients rub their skin against the wall, they don't have enough platelets, they're going to start to bruise easily. And because they don't have any neutrophils, we don't have neutrophils, what does neutrophils do? They fight infection. So they get predisposed, right? Increased or predisposed to infections. Any little bacteria that comes through, get through the door, because the security guard is not even there, right? So they have a lot of infection, and eventually their pancytopenic symptoms can eventually develop into acute leukemia. So this is a very, very unfortunate disease. So how do we make the diagnosis of aplastic anemia? So making the diagnosis. Well, they're going to have normocytic and normochromic anemia. Normocytic and normochromic anemia. And also the best and the most accurate to actually find out what's going on is to go to the bone marrow and stick a needle in there and try to tap it. It's going to be a dry tap. And you're going to have, it's going to show an hypocellular bone marrow, right? And it's going to have absence of the progenitor cells that make all these 3 cell line. So if you do a bone marrow biopsy, you see an hypo, which means low cells. You see a low number of cells inside the bone marrow because it's supposed to be crowded with millions of them, and you don't even find enough of them. So it's an hypocellular marrow. That's what that means. And absence of the progenitor cells. Absence of the progenitor, which means the cell lines, right? The erythroblasts, right? All the stem cells that actually go and differentiate into red blood cells and platelets, megakaryocytes, right? And also the ones that form white blood cells are going to be missing. And that's how you know the patients actually have aplastic anemia. That is the best way. All right? They're called hematopoietic cell lines. Hematopoietic cell lines. Now, how do we treat? It's very, very straightforward. Think about it. The bone marrow resigned. We got to go find somebody and hire somebody else. So let's hire a new bone marrow by doing a bone marrow transplant. That is the only way we can treat this, a bone marrow transplant. Unfortunately, if you don't have red blood cells, you can't really survive. So when they become really severely anemic, they're going to need blood transfusion, right, of packed red blood cells, right? It's basically the red blood cells we can't make. We just give it back to the patient when you're severely anemic. And also, you might need to give them platelets if necessary, if their platelet count is severely low. Also, they might need to be on immunosuppressive drugs. Why? Because you give them somebody else's bone marrow. So when you get a bone marrow transplant, you're going to be on immunosuppressant drugs to prevent your body from rejecting the bone marrow. All right? And that brings us to the end of aplastic anemia. Remember, when you hear aplastic anemia, think of a plastic bone. That's how you always remember it. A plastic bone doesn't make anything, makes no cell lines, which means I'm going to be pancytopenic, which means I'm anemic, thrombocytopenic, and neutropenic. Infections, bleeding. Infection, bleeding, anemia. Infection, bleeding, anemia. Those 3 things, that's how you remember it. The cure is a bone marrow transplant. And what causes it? We don't know. That's called idiopathic. Thank you very much for watching. It's Adeleke again from Future Teaching Physicians. Have a good day. Go have fun out in the sun. Have a good time with your friends and family. Take care. Bye-bye.